Right. Once again, good afternoon, ladies and gentlemen. I hope that was a very good short comfort break for every one of you. So now comes the time whereby we'd like to invite our second plenary speaker, who has been a dedicated advocate for migrant workers in Singapore since he began volunteering with HealthServe in 2010. Now, currently, he leads the training and development team, which provides mental health awareness workshops and training programs designed for migrant workers. Please join me and put your hands together as I like to invite on stage Mr. Jeffrey Chua, our Head of Mental Health Training and Community Outreach at HealthServe Limited, to talk about the challenges and opportunities presented to the healthcare landscape for migrant workers in Singapore. A big round of applause for Dr. Chua, please.
Hi and good afternoon. I think this is the most challenging slot of any conference. Everybody is having food coma, and I have the toughest job of keeping everybody awake, especially when you've heard a lot about what the PCP is all about, what has been happening in this last 2 years or so. Please bear with me, I'll do my best. I will skip those parts that have already been mentioned, and we'll try to do something more entertaining or okay, no, I'm not going to entertain you with song and dance. But yeah, just hopefully it's informative and some stories that will share some of the struggles that migrant workers face. Yeah. So I've been with HealthServe over the past 13 years, and I've witnessed significant transformations in this landscape. As I work with migrant workers, I think our Singapore government has played a pivotal role in shaping some of the policies, especially with regards to what has happened from the COVID-19 situation. In addition to that, I think there have been many organizations that have been doing well, coming together to address some of the issues that migrant workers face. To mention some of them would be our partner NGOs like HOME, TWC2, MWC, who have been actively been in this space trying to do and advocate the rights of the migrant worker, trying to push forward issues that affect them most of all. So I think Singapore has come a long way just to support this migrant worker group. It sounds like a long agenda. I'll share a bit about HealthServe, how we came about, some background on migrant workers, which I think many of us may know already. Our current healthcare landscape also has been mentioned a bit, and the challenges. I think I'll probably focus a little bit more on some case studies of workers that we have worked with and the struggles that they faced, and then how can we improve, or as what was mentioned earlier, what is PCP 2.0 and beyond, right? So HealthServe was established in 2006. This journey began with our founders, Dr. Goh Wei Leong and Mr. Tang Xing Yong. We were just a small, humble clinic in Lorong 23, Geylang. You all know Geylang is famous for food and ... okay? I will not say what you all know. But yeah, so we are on the odd lorongs of Geylang. The odd lorongs are where a lot of food places happen, okay? And some say it's the cleaner side of Geylang. All right, never mind. But Dr. Goh and Shin Yong, Dr. Goh did what he knew best. Being a GP by profession, he roped in many of his doctor friends to come in and volunteer, and that's how we started as a clinic for the people living in and around Geylang, right? So that was our start, our humble beginnings. They volunteered, they offered their services, and during this time, one patient came in to our clinic, and then he said, "Doctor, I feel like killing myself." That caught us off guard. We didn't know what to do. We quickly contacted one of our board members who was a psychiatrist, and she said, "Oh, don't worry, I referred him to you." So what happened was that this worker had an injury. He had a brain concussion, so headaches kept plaguing him, and he came to us for help. Our psychiatrist friends said, just give him a community to be in so that he can assimilate and get back to normalcy again. So yeah, you have Panadol for headache, but there's no Panadol for someone who says he wants to kill himself. Thankfully, through our work, we sort of like did a bit of casework support, bringing the migrants who were injured together and getting them to do things that they enjoy. And that's how this worker overcame his challenges of suicidal thoughts. So the number of workers in Geylang grew, and so there was a need, we saw that, to focus and support them. We know many migrant workers would hesitate to seek migrant help seek medical help for fear that this will jeopardize their job. Either they may get salary deductions for not coming to work. They would get, the worst case would be even being repatriated if they were found to be with some serious illness. I think we all know the number of migrant workers in Singapore, hovering at about 1.1 million work permit holders, including foreign domestic workers, and about 440,000 are in the CMP sector. Okay? So why CMP? CMP, I think we know that these are what we call the 3D jobs: dirty, demanding, and dangerous, which earlier on, Dr. Arvind also mentioned, these are work that maybe Singaporeans are not keen to undertake, or we do not have the skill set to do so. So they come here and they take on these tasks. And the majority of them for Singapore, migrant workers would come from Bangladesh, India, making up about 80 to 90% of the population, and then China, and more recently, Myanmar and Vietnam. So this would be about 8 to 10% of Singapore's population of 5.6 million. And I think having set up the PCP to address some of the healthcare needs is something very noble, and I think we really do continue to want to discuss and see how else can we improve. So at HealthServe, I think our mission is to bring healing and hope to the disadvantaged migrant worker. We believe that every migrant worker deserves to live a life of health, well-being, and dignity. And that is why I mentioned earlier also that we want to see the migrant worker as an individual who has a family back home, be they a son, a father, or a husband to someone back in their home country. And while they are here in Singapore, there's almost zero support from them, and it is our hope to really help them feel at home. Okay? So our approach, we center on providing holistic care that addresses not only their medical needs, which is what we started off, but also the social support. And we actively advocate for the rights and well-being of these workers to bridge communities through outreach events and partnerships. I think what's important to us also is that HealthServe is a largely volunteer-driven organization. While we were running our clinic for the past 18 years, it was 99.9% volunteer-led. So we had volunteer nurses, pharmacists, doctors, all coming on board to run the clinics for us. We survived with one clinic manager to oversee the administration and help to get the volunteers to come on board to run our clinics. That was it, and to open shop, close shop sort of thing. So yeah, I think that's the only way that we were able to support tens of thousands of migrant workers each year by having these dedicated medical professionals and volunteers, some of them also non-medical, but they came along to help and support, and of course, not forgetting our generous donors who have supported us as well. Just some milestones which I might want to highlight in our 18-year journey. I think in 2010, we started a second clinic in Jurong, and 2015, we had another clinic in Mandai. Unfortunately, at the turn of the pandemic, we had to shut down these clinics because of the no cross-infection during COVID. And then the clinic space was used by the hospitals to run their ART centers and isolation centers. In 2014, we started looking into para-counseling services, where we had some students from the various polytechnics and universities come along to engage with the migrant workers, understanding their stories and seeing how they could be supported. And we did our dental services. We started running dental services in 2015. So we all know about what happened during the COVID in 2020, or rather we have forgotten entirely about it. We have vague memories of it. But at that time also, MOM invited HealthServe and some other NGOs to come aboard to form the Project Dawn task force. And together with MOM, ACE, WSH, and these NGOs, we put forward the issues that were causing a lot of stress and anxiety to migrant workers. With that, I think in 2021, we had our crisis helpline launched, where there was an increase in the number of mental health issues amongst the migrant workers, especially when the time that they were locked up in the dormitories or they were on board the cruise ships, where everyone says, oh, they're having a wonderful time on the cruise ships, but actually no. They were locked up in their cabins. Even just to open the door to get a better Wi-Fi signal, they would get scolded by saying, close your door, we want to avoid infection. So it was a tough time for them, especially for those on the cruise ships, just to clarify that it was not a wonderful time. So much so that we had to go down to the cruise center and run some engagement program to let them breathe some fresh air and have a fun time while they were cooped up in the cruise ships. And I think with the establishment of the PCP in 2022, then in 2023, last year, we closed our clinic to do an overhaul and revamp of our dental clinic. And now we have a full-fledged dental clinic, which has 2 dental chairs and X-ray facilities. So at HealthServe, our services continue to evolve to meet the changing needs of migrant workers, but our core pillars remain the same. And we, as a dedicated healthcare charity, we prioritize essential medical and dental services to ensure that the vulnerable community receives the care they need. Yeah? As I mentioned about our clinic, now we are seeing workers who have acute dental issues, like pain in having toothaches, holes in their need that requiring filling. We do not do things like scaling and polishing because it's still cosmetic and we do not have the capacity at the moment. And while we have a desire to expand our clinic services, I think our dental services, what we are faced with is that we have the capacity, but we are unable to find sufficient dentists to come on board to run our clinics. I think probably in the whole of Singapore, there is a shortage of dentists or limited resources that we have. While we so much desire to have dental services for migrant workers, I think we are also cautious with how we address this with MOM and other, the public so-called, because if we are seen as doing too much for the migrant workers, I'm sure Singaporeans will complain. Vice versa, if we do too much for Singaporeans, and then, so where do we draw the line? I think these are things that we need to discuss and talk about, right? So, in addition to dental services, we launched our mental health services, and that happened just before the COVID-19. Right? We were looking into what else could we do for migrant workers. Being a healthcare charity, what were some things that we could do to support the migrant workers? And mental health was one topic that came up quite strongly as we engaged with consultants to discuss our strengths and our potentials. Right? So, as the pandemic unfolded, we were thrown into the deep end of the sea. We were less than 1 year into developing our work in mental health. We only had one staff who was a social worker by training, and he had to put together everything overnight when pandemic hit. We had to seek help from all our psychologists friends, psychiatrists friends, counselors to have online Zoom sessions, group counseling sessions, so that as we reach out to the migrant workers, explain to them what was this COVID about and how to help them. So this went on for during the time of the pandemic, and we started to look into other areas of mental health, well-being, and we looked into the education aspect. And that's where we started to do workshops, basic mental health workshops, and to educate the migrant workers on their mental health and tell them more about stress and how to take care of themselves. So to further support them, I think we also established our 24/7 helpline. We had native speakers. At that time, when we set it up, we engaged Tamil speakers so that we saw a lot of workers, Indian workers who were struggling during the time of COVID. So we thought, okay, let's go with the masses. We had workers, staff who could speak Tamil and engage with this. But that doesn't mean that if Bangladeshi workers or Chinese workers come in, we are not able to address and support them. With the help of our volunteers and other staff, we were able to address their issues as well. We enhance our community services by organizing monthly outreach events such as health carnivals, where staff and volunteers will engage with migrant workers. And additionally, we also conduct mental health training for workers and peer support training. During this time, I think one of the things that we do in the community service, we also invite partners, and I think SATA has been a great partner who come alongside us at our health carnivals to complement things that we are not where we are not focusing on. For example, rehab and musculoskeletal exercises that they will conduct with the migrant workers during these health carnivals. And our clinic work is another area that has illuminated the challenges that are faced by migrant workers, and hence we looked into the work injuries of workers, some of their chronic illnesses and life-threatening illnesses that they face. And then we provide comprehensive casework support, social work support services for them. And our focus is always to empower these individuals to understand their circumstances and guide them on their recovery journey. So through our advocacy efforts, we strive to ensure that migrant workers will receive fair treatment within the healthcare system. Yeah, I think on that note also, I think I congratulate SATA for launching their new migrant workers rehab program, which includes physiotherapy services and maintenance of health maintenance education. I think we have seen a lot of workers with backache problems, and sometimes we find it difficult to help them or to encourage them to recover. One of the issues we have realized that some workers would feel that getting better is not, because of their religious beliefs, getting better is not from God. So they will rather live with the pain or suffer. Right? And of course, there are other workers who think that if they are injured, and then if they have a work injury, they go for rehab, this will reduce their chances of getting a higher payout compensation. Right? Okay. So let's look at the background of migrant workers. I think this was discussed already, some of the things of why they come to Singapore for employment, what are the challenges. We have also talked about this, the percentage of CMP workers in Singapore. Okay, so we know that they come to Singapore to get a better life, to earn more for their families. But what do they pay when they come to Singapore? Does anyone have an idea what are the agent fees? We know it is high. Anyone has any idea? Okay, easily between 6,000 to 10,000. In fact, I've experienced a worker telling me he paid 8,000 to be trained in skills back home in Bangladesh. When it was about time to come to Singapore for work, he was told that you have to pay another 8,000 for airfare, for everything else. So he was thinking, I've already committed half. If I don't continue, I will lose that 8,000. If I put in another 8, maybe I have a chance to come over to Singapore and earn. But just imagine 16,000, how long is it going to take him to repay his debt? don't even talk about 16,000, maybe 6,000 or so. It will take at least 1 to 2 years to fulfill the debt, and that's depending on how much they are paid, right? The daily wage of a migrant worker, for those of you who are unaware, it hovers between 16 to 35 per day. And this hasn't really changed in the last 13 years that I've been with HealthServe. Bangladeshis and Indians earn the lowest. Their average take-home pay on a good month, maybe they can hit $1,000 or so. Okay, if there's no overtime, then their basic salary is only like maybe 450, or for that matter, it is not stated, right? So these are some of the challenges that the financial pressures that they are facing even before they come to Singapore. The debts they incurred will be a large, substantial amount, which will be always at the back of their mind, worrying about how much they can send home to their family, and of course, all the other concerns set in where, what happens if I get injured? What do I do? How do I provide for my family? Yeah? So, through our work, we realized that many of them are uncertain about whether they have healthcare access. And a survey in 2017 discovered that 20% of them were not sure that they had medical insurance coverage. And for those who knew about the coverage, only 1/3 of them had the information about their coverage in their native language. So most of the time, before PCP was set in place, migrant workers did not know where and how to seek help. Okay? And to access healthcare, of course, is a major challenge. I think I was having a conversation, someone mentioning that to see a GP will cost between $80 to $100, and that is really exorbitant. Today, for the PCP, they pay $5. On the one hand, it is very good and cheap, but then I think we also need to consider, is it too cheap? Right? When we started our clinic, we also charged $5 for the workers to have a consult. And we realized that gives them a bit of dignity. I think we are very used to the fact that if it's free, it's a bit dubious, right? Since when are there free things in the world? Okay, in Singapore, okay, yeah. So that was one of the reasons, and we said, give them the ability and the dignity that they can afford to pay for their own healthcare. So that is how HealthServe started also in providing heavily subsidized healthcare for that matter. Yeah. Okay, so let's move on. Yeah, so I'm going to talk about the landscape. I think this one also we know about the PCP setting up, where it has helped to provide the extra care. And you're wondering, why do we need it now? And I think it was already mentioned that in the past, workers self-medicate, they bring their own medication, so it was under the carpet, nobody knows. But with the pandemic, as they went through the hospital system, all the chronic diseases, illnesses started showing, and we needed to do something about it. So briefly, that is how we have started this support for the migrant workers. Okay? So I will not elaborate on this. Yep. As long as they are work permits, and in the CMP sector, they are entitled to this primary healthcare plan. Okay, and telehealth is only $2. The insurance coverage for foreign workers, also briefly mentioned with the PCP, they are entitled to acute and chronic services. And in the hospitals, with the medical insurance, that's another area of coverage where they can get inpatient and day surgery support. So 2 kinds of insurance are mandated by our government. Firstly is that of the work injury, which covers up to $45,000 on medical bills. And then the 60K normal non-injury insurance with a co-payment by the employer is the other portion, which was adjusted just in 2023. Previously, it was only $15,000 for migrant workers to be covered. And we know that that is definitely not enough. I met up with one employer who was supporting his worker because of a burns situation. He said, how am I going to pay all this? His bills for the last 3 months is $500,000. I think if those who are in the burns unit, you know that you need to do dressings daily, and that's where the cost just for consumables just goes up. So that was one challenge that he had to face, but how could he afford? And these are some of the issues that really employers themselves would face. And the gaps that we see right now are that of the ED support, treatments at A&E. So the worker will probably have to pay first before he gets reimbursement, but whether he gets reimbursement by the employer is questionable. Okay, these are out-of-pocket expenses. The other area is if he needs to have specialist or outpatient attention, that is also an area that's not covered by insurance. Although it is mandated by law that every employer needs to provide for the necessary medical care for their workers. Okay, so what are some of the key challenges that migrant workers face in accessing health care? And while we have many improvements, there are still some barriers that impede their ability to receive health care. Okay? And with the PCP in place, we also consider what other challenges that persist in the migrant worker scene. So 2016-17, there was a study done whether migrant workers are receiving adequate health care. This is a survey of many doctors, some about 400 to 500 doctors who worked in the public health, tertiary healthcare institutions. So the three top factors affecting, I think we also know. First, foremost, language and cultural barriers. They struggle to communicate their health care needs, so there'll be misunderstandings or even inadequate treatment of the issues that the migrant worker is facing. Healthcare costs. PCP has definitely made healthcare more affordable. Financial constraints may still pose significant challenges. I think what we talk about is like when you have large companies who are able to afford paying the PCP services for their workers, not a problem. But SMEs and smaller companies where they have only 10 workers and they fork out X amount for their workers' PCP, and then if one or two fall sick with a lot of expenses, that will affect them quite badly as well. And the poor health awareness is the third area where many of them do lack understanding of what is good health and what is good mental health as well. So this can exacerbate the health treatments and condition for them. Okay, I think while there has not been any publications regarding the effectiveness of the PCP, I think there has been ongoing research which indicates that the PCP has become more affordable since the establishment of the PCP, and this is a positive trend. Okay? So the challenges that migrant workers face include, what was mentioned, language barriers, loneliness and lack of social support. It's quite difficult for migrant workers to interact with different cultures. So if they're Indians, they tend to stay with their Indian community. With their Bangladeshis, they will try to be with their Bangladeshi friends. But some companies will have to have a mixture of Indians, Bangladeshis, and Chinese. How do they communicate? That is challenging, but they get around. Okay, we have heard stories where an Indian worker and a Chinese worker are fast friends, but they can't communicate through sign language, and they somehow understand each other. So this is a story that happened quite recently where the Chinese worker was unfortunately involved in a work injury and he didn't make it. And the Indian worker was so distraught, he just didn't know how to handle the loss of this friendship that he had with this Chinese brother. And that's where I'd like to talk about our counseling services, where we came alongside to just support the worker and just allow him to have that time, that chance and opportunity to grieve. So many things that we hear from the workers over the last years, what they encounter. If my mother knows that I'm sick, she will die. This one, I couldn't tell my family that I'm injured at work, or they will be worried. I couldn't explain why I couldn't send money home when they need it. Or the other one, I feel useless. I feel like I don't want to live anymore. And this is a stroke victim. Yeah. So these statements do highlight the emotional toll of the circumstances of migrant workers and the pressure that they face coming to a foreign land. We have talked about the dental needs. We did a outreach dental screening for migrant workers at one of the recreation centers in 2022. We had about 30 dentists and a whole cohort of dental students coming alongside to do a survey. So we screened about 500 workers, and during that time, we just did the basic checkup and made some referrals for them. But again, capacity is a concern. We are not able to see all of them. This dental screening might even have been the first for some of them. We have heard some anecdotal stories, horror stories, where migrant workers actually attempt to pull out their own teeth with a pair of pliers. This is really like reminiscent of some childhood tales, right? When your parents say, okay, I'm going to tie a string to your tooth, I'm going to tie it to the door, I'm going to slam the door, and your tooth will come out, right? So this is what migrant workers understand about dental health and oral hygiene. There is very, very low understanding. 40% have never seen a dentist, or they seek treatment only when there's pain, right? So for those who suffer pain, 1.5%, if you extrapolate it, that would be maybe 6,500 patient visits per year. And if you do the math, you will need a lot of resources to do that. Okay? Like I said, we are running our clinics at about maybe 60-70% capacity. We have space to put in one more dental chair, but we are not able to get the dentist and, more importantly, the dental assistants on board to help run the services. Right? Our wait time has thankfully reduced from 4 to 6 months to 4 to 6 weeks, and thankfully now it's about 2 or 3 weeks wait time. And I think a lot of it thanks also to the support of Migrant Well, who is funding our dental services. Okay, I want to share a story about Mr. S. He's a migrant worker who was paralyzed after a work injury. Okay? He suffered a fall while working on some scaffolding. Okay? And he was attended to by our casework and social services team. And on average, we see about 500 injured workers a year, and we journey with them until the resolution of the case. Okay, just to give you an idea, this is his timeline. All right, within a year, he experienced a fall that resulted in paralysis because of a spinal cord injury. Right? This injury is not just physical, but it also took a significant emotional toll on him. Right? His injury claims also spread for over a year, marked by periods of anxiety, depression, and uncertainty about his future. So this timeline shows how he first came to HealthServe, how he got to know about us, again through the network and partnerships that we have with some of the hospitals. His case was referred to us from Tan Tock Seng. Right? We attended to him. From just the basic services of supporting him on helping him understand what the work injuries process is all about, to the extent that we had to provide counseling services for him as well, emotional support, because he had his own mental health struggles. Okay? And throughout his recovery, he had inadequate support. Okay? He missed several appointments, so much that his treating doctor even had to write a memo, which sort of like went unheeded by the employer. Right? He needed medications. The prescription was not picked up or was picked up late. He needed a gel, a lidocaine gel for his catheterization, which was also not provided, or they bought an alternative which was not the right kind of medication. He needed a cushion when he sits down on the wheelchair. It was also not purchased for him, and even at the time of his repatriation. So just a few months ago, Mr. S was repatriated and returned to India. He received extensive support from us through interventions as well and counseling sessions that we also lost count. At times, the counseling sessions went well. At other times, our counselors get scolded by him, say, what are you doing? You're not doing anything for me, you're not helping me. I think his concern was also on finances, which was also a struggle because his average monthly wages was disputed by the insurance and by the employer. And in the end, he succumbed to probably a slightly lower compensation, and he went home to be with his family. When he went home, he lingered on at the airport. He said, I'll only go back home after dark. So that was his state. Was it a good ending for him to go back home like that? We do not know. But we know he's back with his family. I encountered a similar case of a 28-year-old Indian worker who similarly fell from height working on scaffoldings. His contract was about to end, and he was about to go back to get married. This fall, which left him with a spinal cord injury, dashed hopes of any future that he had. A former colleague of mine managed to visit him back in India, and the mother told him, I lost my son. Okay? So there's no more life for him. That's what we think. But I'm friends with him on Facebook, and I've seen his posts. You'll never believe what he's doing actively now. He runs wheelchair marathons back home. I think that is so remarkable that he has bounced back up, although he is in a wheelchair, but he decided to do something meaningful with his life by participating in wheelchair marathons and also encouraging other workers who may have had similar injuries and are confined to a wheelchair. I think that is really wonderful. Okay, so yeah, this is Mr. S. Another story of Mr. H. He was also referred to us by a hospital, and the nurse clinician said that there's concerns over his escalating medical costs. Okay, no subsidy program for foreign workers. I think that we are very sure of. Medical insurance already utilized for 2022, and employer was unwilling to cover the extent of medical bills. So ulcerative colitis is something which is chronic, and there'll be escalating costs involved. Perhaps Mr. H was somewhat better off than Mr. S, possibly because employer eventually did agree to make payment of his medical bills, but the cost was high. We intervened through discussions with the hospital to see how we could stagger his medical visits such that he could take the medication in the hospital as treated as day patient services so that we could tap on the insurance to provide for him. And we also provided with some financial support so that he would not have to face with so much out-of-pocket expenses. And in June, he returned home for follow-up treatment. And I'm glad to say he has found himself another job back in Singapore and continued to provide for his family. Okay. Another story of, I think probably you all might be very more familiar with this, Rubel. His story has been circulated on the news media, in social media, and he's been very active. Okay? Despite his long working hours, he has created awareness about the migrant community in Singapore when he started the Migrant Cultural Show in 2018. He also did the Migrant Library to enable workers to access books of their own language. And his battle with cancer, colon cancer in 2022, brought him to the public eye, and a lot of public had compassion on him and supported him through fundraising and contributed to him for his medical care. So while he was able to get some treatment and diagnosis here in Singapore, he soon got to know that his cancer had returned in May earlier this year. and he decided that he would have to make the hard decision to return home and spend the remaining time with his family. So I think these are some of the complexities, emotional complexities that migrant workers face when dealing with severe health challenges. So the stories of Rubel and the others illuminate an immense financial burden that can accompany severe illnesses or injuries. And we ask ourselves, have we put in place sufficient measures to support migrant workers during such crises? Are employers doing enough to assist their employees? There may be no right or wrong answers. Some are doing very well to help their workers, paying all the medical bills, but some will stop short and say, no, I cannot afford anymore. But where do we draw the line? Where do we say enough is enough, or I will want to go overboard for my workers? And on the medical scene, when do we say that we've provided enough and sufficient care for the worker, that we have to let him go back home and continue treatment? I think there are no clear answers on this, and I think we as a society continue to explore improvements and consider how do we create a more supportive environment for the migrant workers. So some ideas that we have to continue to enhance communication and language. Good that the anchor operators are recruiting local native speakers or translators who can help with the language of migrant workers. I think through our networks and through collaborations, we can also mobilize resources to meet the needs, just as we have referrals from hospitals, or we are called in to provide a translator to a patient who is in the hospital and they do not have any resources at that point of time. I think we can also tap on the migrant workers themselves. They should be able to translate those who are maybe better in speaking in English and can communicate to their friends. And I think when they hear people speaking in their own language, and they will feel more comforted. Just like sometimes when we go overseas on a holiday, and then everyone, I'm not being a racist here, where everyone is of a different color, and then suddenly you see someone Chinese say, oh, you start speaking to them in Hokkien or in Teochew, and you have that affinity of like-mindedness, and you realize that he's from Malaysia, but you still can communicate with him. So these are some of the nuances that I think as human beings we tend to gravitate towards. Yeah. So migrant workers can themselves play a role to support their friends by being the interpreters or translators as well. Okay. Cultural competence training, I think is also mentioned that this is effective for effective care. One of the primary factors that was identified. And for us at HealthServe, when we run our events, we do brief all our volunteers about the cultural nuances as you interact with the migrant workers, so that they get better equipped to engage with the workers. And I think when the PCP was established, they have prioritized and understood where the care gaps are, and they have provided what we call the healthcare assistants, right? People who can speak the language and help to be the middleman to translate and understand the problems of the migrant workers, right? So this is a good initiative. Kudos to MOM for setting this up so that we really get closer to the migrant workers. Okay, policy recommendations. I think the Forward SG conversations have been helpful, that they have also highlighted migrant workers and how we need to care for them. And there are still opportunities, I guess, for improving our things like insurance coverages, access for non-CMP workers, chronic disease management, and specialist outpatient treatments, which we can focus on as well. Maybe part of the PCP 2.0. I think many NGOs, corporates, community organizations have stepped up to the platform to support migrant workers. For example, Singland, who do shopping and lunch sessions with migrant workers and buy them necessities. Salvation Army, who has provided a whole string of services for the migrant workers as well. Even before COVID started, we had a group of doctors who have been going around sharing about migrant workers' plight. So they have put together intranet pages of what they can do if they encounter migrant workers, how they can support. They've also written pamphlets of how do you treat foreign workers. And I think these are good initiatives that not just HealthServe can do, but everyone else can do as well. Peer support leaders is another area which we are focusing quite heavily on to get migrant workers trained so that they can lend a listening ear to their co-workers and their fellow countrymen. Okay. This is something we have developed with MOM to make them be the eyes on the ground to support the migrant workers. We are not saying that they are the ones to solve the problems of their fellow workers, but to be able to identify and to seek attention and seek help if it arises. Okay, and they can always contact us, or whichever area of need, they can always point the migrant worker who is affected with distress or anxiety. Okay. One interesting story also we heard from one of the trained workers. He helped a colleague who had a family member suffer a stroke. So this colleague was really anxious. How do I talk to my family? How do I comfort them? So this PSL trained leader said, let me talk to your family. I'll calm them down. And not only did he talk to his family, he also supported them by helping to find physiotherapists within India who could support and the family as well. So these are fruits that we can bear when we work with the migrant workers. Okay, so in summary, we need to adopt a holistic approach to the health of migrant workers, and each organization, I'm not saying that HealthServe has all the solutions. I think with SATA coming on board, with the other NGOs doing their part to support migrant workers, MOM also making sure that employers are doing their part, I think we can all come together and collaborate and leverage on each other's strengths to provide the necessary healthcare and support. And together we would continue to enhance the well-being of the migrant workers in Singapore. Thank you.
Thank you very much, Mr. Chua. Now, once again, the floor is now open. Do we have any questions? Oh, I thought the lady got up wanted to ask a question. Okay. Anyone else? Actually, that was really a very, very interesting presentation, and we learned so much about migrant workers and the challenges they have to face through. So we have a much better understanding. I was feeling a little bit emo just now, but I'm okay. So no questions, really? Okay, great. Once again, a big round of applause, and I'm going to invite back on stage. Please hold on. Yes, our SATA CommHealth CEO, Dr. Kelvin Phua, to present a token of appreciation to Mr. Chua. And the same thing, we're going to have a photo session here to capture this moment. All right, ladies and gentlemen, once again, a big round of applause to thank both gentlemen. Thank you so much.